Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Dizzy after eating. There are many reasons why you may be dizzy after eating. While dizziness usually occurs if you've gone too long without food, things low blood sugar, low blood pressure, and certain diabetes medications can also sometimes cause dizziness after a meal. /r/n/r/n By pinpointing the cause of dizziness after eating, you and your healthcare provider can find ways to minimize or entirely avoid future episodes. /r/n/r/n This article explores the causes of dizziness after eating, including ways to treat and prevent them. /r/n/r/n Simple Images, Getty Imagesrnrn Several different conditions can lead to dizziness after eating. For some people, dizziness may be caused by a quick drop in blood pressure from standing too quickly after sitting, a condition known as orthostatic hypotension. /r/n/r/n Some eating-related causes include a post-meal drop in blood sugar or blood pressure, the effects of certain diabetes medications, and certain food allergies or intolerances. /r/n/r/n Nondiabetic hypoglycemia is a rare condition in which blood sugar levels drop in people who do not have diabetes. /r/n/r/n Typically, blood sugar levels increase following a meal. However, when a person experiences low blood sugar 2 to 5 hours after eating, it is called reactive hypoglycemia. This is a type of non-diabetic hypoglycemia that can cause dizzy spells after consuming high-carbohydrate foods. /r/n/r/n Symptoms of reactive hypotension include /r/n/r/n People with prediabetes are more prone to reactive hypoglycemia. This is because they have trouble producing the right amount of insulin, which helps regulate blood sugar. /r/n/r/n Bariatric, weight loss. Surgery can also lead to low blood sugar because it causes metabolic changes that lead to excess insulin production after eating. /r/n/r/n If a person does not eat enough carbohydrates after taking insulin or other diabetes medications, it can lead to low blood sugar and dizziness. The timing can sometimes be tricky, given that certain foods are absorbed faster than others, such as beverages, which are absorbed quicker than solids. /r/n/r/n Symptoms of low blood sugar include /r/n/r/n Injecting too much insulin, or injecting it directly into the muscle, can also lead to hypoglycemia and dizziness after eating. /r/n/r/n Low blood pressure after eating, also known as postprandial hypotension, is a condition that affects up to 1/3 of older adults. /r/n/r/n Postprandial hypotension happens when a person's intestines and stomach demand extra blood for digestion, resulting in decreased blood flow to other body parts, including the brain. /r/n/r/n It is a condition most often due to aging-related changes that interfere with the body's ability to respond quickly to sudden changes in blood pressure. A major culprit is hypertension, high blood pressure, which stiffens arteries and makes it harder for them to narrow and relax when needed. /r/n/r/n Symptoms of postprandial hypotension can develop abruptly and cause /r/n/r/n When a person with a food allergy comes in contact with a trigger food, they can experience dizziness and other symptoms within minutes to 2 hours of ingestion. /r/n/r/n Symptoms of a food allergy may include /r/n/r/n When a food allergy causes dizziness along with rash or hives, rapid or irregular heartbeat, wheezing, shortness of breath, and swelling of the face, lips, tongue, or throat, you need to call 911 immediately. These are signs of a potentially life-threatening, whole-body allergy known as anaphylaxis. /r/n/r/n Certain foods may trigger people with specific conditions, causing dizziness after eating. For example, people with Meniere's disease should avoid salty foods because salt can increase pressure in the inner ear, worsening dizziness. /r/n/r/n alcoholic beverages, in particular, can also be a trigger. This is because alcohol in the blood can affect the inner ear, causing a feeling like the room is spinning. Alcohol can also cause low blood sugar when it interacts with diabetes medications. /r/n/r/n food intolerances may also cause dizziness after eating. For example, limited evidence links lactose intolerance to lightheadedness and feelings of intoxication. /r/n/r/n Additionally, a person sensitive to caffeine may become dizzy after drinking caffeinated beverages. /r/n/r/n Certain foods or food ingredients may trigger migraines, which can cause dizziness. The most common food triggers reported are /r/n/r/n treatments for dizziness after eating involve addressing the root cause. /r/n/r/n If a person has dizziness due to low blood sugar, the immediate treatment involves eating or drinking 15 to 20 grams of carbohydrates. This is equivalent to half cup of fruit juice or 6 or 7 hard candies. /r/n/r/n If the reason is an allergy, antihistamines like claritin, loratadine, or Zyrtec, cetirizine, can counter the effects of histamine which triggers allergy symptoms. Certain antihistamines like dramamine, dimenhydrinate, Benadryl, diphenhydramine, and antivert, meclizine, are specifically used to treat vertigo, spinning sensations, and nausea. /r/n/r/n For postprandial hypotension, there is no definitive treatment. However, you can reduce symptoms by lying down until the dizziness stops. /r/n/r/n Minor episodes of dizziness usually resolve on their own and do not require a trip to the emergency room. However, call 911 if any of the following symptoms accompany dizziness after eating. /r/n/r/n If you continue to experience dizziness after eating without life-threatening symptoms, you should schedule an appointment with your healthcare provider. It could be a sign of another treatable, underlying condition. /r/n/r/n To diagnose the cause of dizziness after eating, your healthcare provider will start by reviewing your symptoms, medical history, and family history, such as a history of diabetes. /r/n/r/n If dizziness occurs exclusively after eating, your healthcare provider may want to measure your blood sugar and blood pressure before and after meals to see if there are any fluctuations that might explain your symptoms. Other tests may be used if a food allergy or food intolerance is suspected. /r/n/r/n The tests may include /r/n/r/n Other tests may be used to detect specific food intolerances. /r/n/r/n There are several techniques a person can try to reduce or prevent dizziness after eating. /r/n/r/n Feeling dizzy after eating is often related to an underlying condition such as high blood pressure or prediabetes. It can also be caused by food sensitivities, stomach surgeries, or enzyme deficiencies. If you frequently feel dizzy after eating meals, it's important to let your healthcare provider know. They will be able to run tests and determine the root cause. /r/n/r/n A person who has prediabetes or is at risk for diabetes may experience dizziness after eating because their body is not producing the right amount of insulin, causing blood sugar to fall. /r/n/r/n Standing quickly after sitting down for an extended period can reduce blood pressure resulting in dizziness. Pregnant women who experience dizziness after eating often experience improvement after delivery. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.